Hey, you're listening to Rising into Mindful Motherhood. I'm your host, Dr. Katie Wood. I'm a barefoot mama bear, pharmacist, integrative fertility health coach, and lover of all things nature and animals. I'm on a mission to have intentional conversations about the good, the bad, and the ugly when it comes to fertility, pregnancy, postpartum, and beyond. My mindful guests and I will be talking about struggles, wins, natural wellness, and how we grow and transform as we enter motherhood. My background in healthcare has shown me how broken our medical system is. My own struggles to become pregnant has shown the lack of support for mamas to be, the lack of guidance for women to have a nourishing and vibrant pregnancy, the isolation, mom guilt, and all the things we hold after bringing baby earthside. I want this platform to be a place where women can feel connected, safe, and supported to share and hear their stories. A place to use our voice to discuss and advocate about what we need and deserve as mothers. So let's dive in, shall we? Hello and welcome to Rising into Mindful Motherhood. I'm super excited for our conversation today as I'll be talking with Dr. Nina Palombo, a pelvic floor therapist. She is the owner of Horizon Physical Therapy, and in her practice, she focuses on treating women during pregnancy and postpartum, as well as male and female pelvic pain conditions. Today, we're going to be discussing pelvic floor therapy during pregnancy to prepare for birth, common postpartum issues, and pelvic floor misconceptions. So I'm super excited because I actually personally used a PT for pelvic floor during my pregnancy and postpartum, and I think it's super important. So welcome, Nina. I'm so excited to have you here.
Yeah, thank you. Thank you, Katie, for having me on. I'm excited to chat a little bit about pelvic floor. Like we, said before, a lot of people might not know a lot about this or exactly, maybe they hear about it, but don't really know who it's for or what we're doing. So hopefully we can just put some info out there that help people kind of navigate this whole world a little bit better.
Absolutely. And I would love to dive into your background, maybe your journey to kind of figure out how did you get to where you are today? What really made you decide to specialize in pelvic floor therapy?
Yeah. So for me, it wasn't when I was like going through PT school, it was not really on the front of my mind. And we honestly didn't even talk much about it. I graduated in 2015 from PT school. And yeah, I think we had 2 days where they just barely talked about it. They brought somebody in, but it was very like surface level and kind of just told you, maybe you can get a clinical or specialize after you graduate. That was really sort of all I had. And then I started working as a PT. And I think it was a combination of like, I didn't really know where I fit in the PT world. Like I tried a couple of different settings and just none of it felt great. And then at the same time, I was dealing with some pelvic floor issues myself. So I went to get treatment from a pelvic floor therapist in the area. And it was just really eye-opening to me, like everything she taught me about my own body and about my issues. And it like made so much sense. And I was just, why did nobody tell me this stuff before? And working as a PT, still just like not knowing anything that she taught me. So kind of looking for a new area and then having that experience kind of kept leading me in that direction. And then I got lucky and a hospital system from around where I was from was willing to hire you and give you a lot of training. So I kind of just jumped on that opportunity and dove right in. And that was in 2016. So I've kind of been in the pelvic floor world since then. And I think what made me stay was just realizing all the different things that people might come to you with. Like I said, I think when I first took my, in school, when they talked about it, it was just stress incontinence. That's all they talked about was women who might like laugh or sneeze or jump and experience a little bit of leakage, but it goes so much bigger than that. And I think once I saw all the ways that we can help people, as well as like everybody says like, oh, I didn't know about this. Why didn't I know about this sooner? So I just like to be in that space of like helping to educate and people understand their bodies better. So yeah, that's sort of how I fell into this whole realm of pelvic floor work.
I love that. And it's so fascinating to me how they just kind of brushed over it while you were in school? Because that even happened for me in pharmacy school. Like we learned oncology in a very short
Mhm.
span of time, like respiratory stuff. And it's just fascinating how that happened. So I'm
Yeah.
glad that they had that opening for you and you were able to really get that experience under your belt.
Yes.
Um, so for me, I remember, growing up, my older sister, after she gave birth, it was a hard and a long birth. I think
Mhm.
she ended up pushing for like 4 hours or something. And she experienced, some of that like incontinence that can happen after
Mhm.
you give birth. And I feel like society makes you feel like that's normal and that's just
Mhm.
part of postpartum life and being a mom, like, in that there's
Yeah.
nothing you can do about it. So I'm so thankful for social media in the way it is now because I think I was exposed to some accounts and was like, oh, wow, this is an option. Like,
Mhm.
I'm going to tuck that in the back of my mind for when that day comes. And
Yeah.
when I was pregnant, I found a local PT. I can't remember when I first started seeing her, but she really prepared me in terms of like, here's certain positions that could help you
Mhm.
while you're in labor. And just, I don't know, it was just so helpful to also have someone to like talk to, like, hey, this is what I'm
Mhm.
feeling, because, things kind of, your entire body like rearranges to have a baby. So
Yeah.
I would love, well, let's start with pregnancy. I would love to kind of cover the benefits of starting to see someone in your pregnancy and when you would maybe recommend like what trimester that you seek out someone, or maybe it doesn't matter. I'm not sure, but I'd love to touch on that.
Yeah, I mean, I think pregnancy is a big time when a lot of people are questioning, like, should I go see somebody or should I just wait till after? But the benefit of starting during your pregnancy, I think there's multiple, but like one is just like you start to build a relationship with somebody that knows you and knows your body and gets some of your information from pre-pregnancy. They know what your pregnancy's like. So then that postpartum rehab, we already have so much background information and you're already comfortable with the person you've been working with. So I think that's a big part of it, just the relationship building.
Hmm.
Um, but then some clients come in and we are treating like active concerns. Maybe they are having like pelvic pain, SI pain, already starting to have some leakage. So we can address those concerns as they come up, instead of just waiting till after, waiting until kind of maybe more things pile on top. It's easier to just get in front of it if we can.
Hmm.
But honestly, a lot of my clients are coming in more proactively, which is really great to see. They may have a few little concerns, but realistically, they just want to know like, what can I do to prepare for delivery? What can I do to like get ahead of all of this? And I think that's a really cool shift that people, that I'm seeing. Also, I'm in a different type of clinic setting now, so maybe that has something to do with it too. But it's really exciting. We get to check in on not only their pelvic floor, but really like head to toe, because so many changes happen. We might be working on postural training and breathing and body mechanics when they're bending and lifting, because all of that's getting really awkward and really hard to do as pregnancy goes on. From a birth specific standpoint, we can assess if there is any type of like excessive muscle tightness or tension. It's really good to learn how to release that and relax going into deliveries.
Hmm.
The pelvic floor's job during when that baby is being born is just to kind of relax and get out of the way. We don't, the pelvic floor isn't pushing the baby out. It just literally needs to relax. So if somebody's living with a bunch of pelvic floor tightness, that could be a potential kind of barrier at the end of labor. We can also assess somebody, I'll have them try to like show me how you would push during labor. And what I want to make sure is that they're getting a effective push, but also their pelvic floor isn't tightening up against as they try to push. Again, just making sure everything's kind of coordinating together is really helpful information. And a lot of my clients, when they leave and we get everything kind of coordinating and doing well, I think it's just this boost of confidence of like, oh, my body knows what it's doing, like going into labor. And like you mentioned, we can talk about different positions during labor and postpartum, and delivery, so that they have some ideas of where their body is trying to go, and you're not making all those decisions in the moment.
Hmm. Absolutely.
Yeah.
I love that they're people are coming to proactively, because I do
Yeah.
remember my one friend, I can't remember what it was called, but it was some sort of like pelvic pain. Is it like SPI or SDI or you?
SPD, like the
Yeah.
pubic symphysis pain.
Yes. Mm-hmm. Which
Yeah.
it sounded awful. I feel like maybe I had a very small amount of that, but hers
Yeah.
was really, really bad. And
Yeah.
I'm pretty sure that she also seeked out some therapy in terms of that. So one thing that I remember is like exercise. So especially as you go farther into your pregnancy, really learning how to like engage, like properly engage
Mm-hmm.
your pelvic floor,
Yeah.
abdominal wall. I would love to hear like any tips you have on that.
Yeah, I think that that's super important. Just because as pregnancy goes on, there's obviously more and more stress and strain in through the pelvis, the pelvic floor, all of those tissues are just working really hard. So anything that we can do to try to help to support them and allow them to kind of just get the most out of it that we can is going to be super helpful. So a few tips that I try to tell people is when you're going to lift something, whether that's other kids that you might have or the carrier or the laundry basket or whatever. So as you're bending down to grab that object, taking a nice inhale, but when you go to lift that load, doing a nice exhale through the mouth. So I'll say, like, imagine that you're blowing out candles. So a nice exhale. And what that does is it helps to engage your core a little bit. It's like this little automatic engagement, and it starts to take away pressure that we might potentially be pushing down onto those tissues of the pelvic floor. Because what a lot of us do when things start getting heavy or hard or awkward is like hold our breath and strain to lift that thing, but that's just pushing a lot of load downward. So even just getting into the habit of exhaling through lifting, exhaling through movements is super helpful. When we're trying to find the deeper core, it's really different person to person. And what I'm doing usually is like feeling and watching how their belly is engaging, because what works for one person might not work for another one. But I think during pregnancy, a nice one that I'll have people try to do is take an inhale through their nose. As they inhale, they'll feel like their belly and rib cage expand. And as they exhale, they're blowing out the candles, but I'll tell them, like, imagine you're giving the baby a hug. So it's just this really gentle, like pulling in and up of the belly during that exhale. And that's how we can really connect with that deeper core. It doesn't have to be like, like a crunch or like you're bracing, like somebody's going to punch you in the belly. It's a much like gentler kind of engagement while we're breathing. And then once you kind of learn that, you can do that during different exercises. You can do that while you're lifting the thing, what we talked about, like while you're lifting throughout the day, but just learning that like subtle, basic exhale. And like I said, I like the cue of give the baby a hug because that helps during pregnancy. That helps people find the deep core. The other thing that can be really helpful during that time is being really mindful of like our posture and alignment, because as the belly grows and there's different, again, just lots of tugs and pulls, the body's going to want to do a lot of different things to just kind of get through the day. But what I try to encourage people to think of is having like a stacked posture. So like the rib cage is right over top of the pelvis. And I know that's kind of hard without being able to like demonstrate. But if we think of somebody who maybe like is like carrying the baby on one hip and your hips like kicked out to the side, or even like when you're carrying like the carrier or the belly like pulls you really forward, those are kind of pulling you out of alignment, which makes it much harder for those deeper core and pelvic floor muscles to do their job. So really it's just the breathing and then the alignment. Those are two things that I think really, like, anybody, whether you're pregnant, postpartum, any phase, can start to be a little bit mindful of throughout the day. And that can be really helpful.
Yeah, great tips, especially for someone who maybe has a little one at home already and then they're pregnant, with their second, third, fourth, whatever it is. But
Right. Yeah. I mean, there's so much bending and lifting and awkward angles and all the things. So, we can't always do those movements perfectly, but if we could at least breathe through it and bring a little bit of awareness to maybe how we're positioned, that at least helps support in the moment. But then, also, like, keeping the glutes strong, hip strengthening, like kind of more well-rounded strength training is also still going to be super helpful. And I really like to encourage that. But again, that's just kind of more just like general strengthening. The more strength we can maintain, I think is just going to help the body be able to handle the demands of pregnancy and caring for a new baby, because that's also a ton of work and demand on your body. So we want that strength for sure.
Mm-hmm. Yeah, agreed. And I remember always trying to be very cognizant about, I think it's called coning, when like when you're pregnant, like if you're doing specific workouts that you really kind of want to avoid that.
Yeah, so that the coning, or sometimes people call it coning or doming. But yeah, the same thing. I'll hear them used like interchangeably, but it's seeing that like I guess you would describe it as like a bulge in the center of the belly. Sometimes like if you're going to sit up out of bed or doing different, usually like more crunchy type movements, you might see that happening. And what that just indicates is as the belly's growing, that line in the middle, which like people who have like really, six-pack abs, you see that line right down the middle, that's just like a connective tissue. So as the belly's growing, all of that stretching as well. And when we see that doming or coning during movement, it's just a sign that like the amount of pressure we're creating from the inside isn't quite being matched from the strength of the tissue anymore. So that's why we see it kind of like poking or pushing through. And it's just maybe a sign that we might be stressing that tissue a little bit more than we want to in this moment. So sometimes it doesn't mean you shouldn't be exercising, but maybe we need to make sure we're not holding our breath through that movement. Maybe we need to just scale back 1 or 2 steps or lower the weight a little bit, just to not overly strain that like midline of the abdomen. You can still do core work during pregnancy. I think it just looks a little different than what we think of in terms of like sit-ups and crunches, and those aren't the worst thing in the world, but they might not be the most beneficial, especially to like a growing, stretching, changing belly. Yeah.
Do you have any exercises? Because I just, and this was like 2018, 2019 that I'm thinking back from my personal experience, where, because you do kind of want to keep your core somewhat strong, but like you were saying, you don't want to overdo it. So say someone wants to kind of keep their core strengthened, but we don't want them to do like the traditional crunches. Like, what are some exercises that you might be able to describe that you would recommend?
So I do still have people doing sometimes things like planks, but instead of doing them like down on the ground, we might come to an elevated, like their hands are like on their kitchen counter or like a dresser or something like that. So when you elevate it, it takes a little stress off of the belly. And then what I try to do in that position is, instead of like, usually it's like hold your plank for 60 seconds or a minute or whatever, I have them get into that position and then do that nice breathing with the inhale, exhale, pull the belly up and in, and then release. And they're kind of go through maybe just like 3 to 5 breaths and then get out of the position. So we're not like just sitting there and holding and straining, but they're learning how to breathe and engage their core while in like a modified plank position. I think that's a good one. Another exercise I like is called a Palombo press. I don't know. I could maybe like send a video, but I'll try my best to describe it. You have like a band or a cable machine like anchored at the door, and you're standing sideways to it, and then you just kind of press that band in and out. And again, it doesn't feel like much is happening, but because the band is trying to pull you and rotate you, you have to like stabilize through that. That might be better for like a video or something. That's a hard one to describe. So I like that one. Even doing like, if you were to do a squat and hold the weight in just one arm, it's like asymmetric, and that alone makes your core engaged. So sometimes I'll just start doing things like that, like squat with weight on the right, then squat with weight on the left. Going down into like a kneeling, like a half kneel, and do like one hand up overhead shoulder press. You'll be surprised how kind of like wobbly and off balance that feels. And then you have to use your core to stabilize. So it's almost like, I kind of like mix it in with other exercises so that it's like slightly asymmetric or slightly unbalanced, and we're learning how to stabilize through the whole body. Versus again, just like a sit up where you're just totally isolating those ab muscles.
Mm-hmm.
So yeah, those are kind of hard to explain when we can't like show it on video or demonstrate it.
Yeah, great tips though. Thank you. Is there
Mhm.
anything else you can think of in terms of pregnancy before we move on to postpartum?
Um, so we did mention like the doming or coning, but I guess some other symptoms like that somebody could be experiencing if they're not just like, in that proactive mindset, but if they're actually experiencing some things. So any type of like urinary leakage would be a sign that maybe the pelvic floor could use a little bit of assessment and treatment. Um, Feeling a sense of like heaviness or pressure in the vaginal area could be another thing we might want to check out for. Any kind of pain around the pelvis. So we talked about like the pubic bone, the SI, tailbone pain, all of those we can treat. Um, and then, during pregnancy, it depends, but a lot of times we'll see clients for pelvic pain and like pain with intercourse. So that can sometimes be a sign of like pelvic floor muscle tightness or tension. So,
Mhm.
really, any of those would be like things that would warrant coming in for an assessment. And again, you totally can wait till after you deliver, but it might be good if there's some type of pelvic floor dysfunction to get that taken care of before you're delivering the baby.
Mm-hmm.
Um, so yeah, I
Definitely.
think
And I think, like you said, establishing that relationship and maybe just having those appointments in the books, because once you do have baby, it can be
yes,
really easy to be like, oh, I'll do that later.
yeah,
And then you're 6 months
for
down the
sure.
road and still suffering from whatever it may be.
Yeah, yeah. So sometimes you're exactly right. Like having that appointment set up, and I always tell my clients like this isn't set in stone. Like if you need a little more time, or due dates change, like we don't have to meet exactly on this date, but just having it in the books is really helpful. And then like at my office, I do like treatment packages. So a lot of times they'll purchase a package during pregnancy, knowing that they have like 3 to 4 visits saved up for postpartum. I think also makes people a little more likely to then keep up with the postpartum care and come back in and give themselves that time. So yeah, I think it's like a mindset thing too. You're just like planning for the future a bit more.
Mm-hmm.
Yeah.
Awesome. Yeah, I love that you offer packages.
Mm-hmm.
So yeah, let's dive into postpartum. So I know you had mentioned that you wanted to talk about some common postpartum issues that you see. So I'd love to hear about that. Today's episode of Rising into Mindful Motherhood is proudly sponsored by the Confident Conception membership. Are you or someone you know on what feels like a never-ending journey to motherhood, facing an uphill battle of fertility challenges? I'm Dr. Katie, your podcast host, pharmacist, and integrative fertility coach with over a decade of experience. I've been where you are, and I understand the roller coaster of emotions and heartache. That's why I've created the Confident Conception membership, a program designed to help you address the real reasons behind fertility challenges. Like my client Elizabeth, who struggled with fertility for 9 years, having tried and failed other programs. She was in disbelief when just a couple of months into using my Confident Conception method, she finally got her first positive pregnancy test and welcomed her healthy baby boy this year. Using the Confident Conception method, we combine traditional medicine and energy healing to unlock your innate and abundant fertility potential. This isn't just about putting a Band-Aid on to cover up the physical symptom. It's about healing the energetic and physical root causes. As a member, you'll receive personalized guidance, bi-weekly live coaching calls, and become a part of a supportive community of like-minded women who truly understand what you're going through. We offer flexible payment options, plus our annual members receive exclusive savings and bonuses to accelerate their path to pregnancy. Don't let another month of frustration and overwhelm pass you by. As a special offer to our listeners, you can use the promo code PODCAST10 to receive 10% off the lifetime of your membership. Secure your spot now and expedite your journey to motherhood today by visiting www.yourempoweredfertility.com/membership to learn more and enroll. Together, we'll pave the way to your confident conception for a future filled with joy, unconditional love, and the pitter-patter of tiny feet. The link is in the show notes. Sign up today and your future self will thank you.
Yeah, I mean, it's really honestly like that's a similar list to what we talked about already, but we may start hearing, instead of someone just describing it as like pelvic pressure or heaviness, they may have an actual prolapse diagnosis. So if you're diagnosed with a prolapse, we can absolutely help with that. Any type of urinary issues, like I said, the pelvic pain with intercourse, there are, I forget I think it was like 1 in 5 women have pain at 18 months postpartum. They're still having pain with intercourse. And I think that's another thing that can get very brushed off, like, oh, you just had a baby, or oh, give it time, or, there's a lot of awful things you'll hear people kind of being advised around pain with sex. But yeah, that's a big one. Honestly, that's a really big one that I get in my office. So any type of painful intercourse, diastasis recti, or that like abdominal separation.
Mhm.
So yeah, so that's really the list. But honestly, in a lot of other countries at 6 weeks postpartum, it's like standard of care that they're seen by a pelvic floor therapist. So
Wow.
realistically, again, you don't have to be symptomatic just to come in and get an assessment, get an idea of where your body is. So like, okay, if things are all good to go, then someone only, maybe they only need one visit, but they have that information of like what's going on. So I think our country much more takes the approach of like, wait it out. This is normal. Things will improve. And sometimes they do. There is obviously natural healing that occurs. But yeah, we can definitely jump in and help to like optimize that healing so the body really reestablishes that connection with the pelvic floor and core instead of what I see a lot is compensation. So the body's going to, you have a new baby to take care of, you have all these things, maybe other children, like you're not going to just sit around and do nothing. So your body's going to get the job done. But sometimes that's at the expense of the pelvic floor or the core because those muscles haven't had a chance to totally heal yet. So yeah, so reestablishing that like foundation of strength is like number one thing we want to work on postpartum.
Mhm. Yeah, you gotta love that blanket statement of you can start working out again at 6 weeks and
Mm-hmm.
without really being checked out and seeing how things are working. I mean, I remember I don't think I really even felt totally like I could get back into my regular routine until like 1 year postpartum. And I think some women just they take that recommendation at face value and they just jump right in. And there's just so many things that you could do that could make your situation worse.
Yeah.
Because I just remember doing a lot of work with my physical therapist because I had like was it like between 1 and 2 fingers worth of like the separation. So
Okay.
really just
Yeah.
working on strengthening that. And my pelvic floor was like totally shot because I think my daughter came out with her hand on her face. So like
Gotcha.
that side of my body was definitely um very, very tight. And I think the other
Mhm.
side was compensating. I don't know. I can't really remember, but
Yeah.
just so thankful to have that guidance and support because it is really hard to know what's going on internally. And you can kind of have that understanding of ways that you can do things better. Like I just remember working on my breathing and engaging like
Mm-hmm.
that actually just working on that breathing eventually toned my
Yeah.
my abdominals from
Sure.
birth and I wasn't even doing anything like extensive or anything like that,
Yeah.
so that was pretty fascinating to me.
It is. Yeah. I mean, a lot of my clients, I tell them that when we start, like initially, it's almost harder mentally because you're doing this like work of like tuning into your body and maybe breathing different ways and engaging different ways. So it's almost harder mentally than it feels physically.
Mhm.
But it really can make a big difference.
Mhm.
And, everybody's journey of what their body might need postpartum is a little bit different. And what we need to work on might be a little bit different, but that like breath work, that engagement, that like foundational connection is really can really just go a long way for people. So yeah, I think that's really cool that you were able to experience that and go through that with your therapist. That sounds like it was really a good experience.
Yeah, it was. And I'm trying to remember, I don't know if I waited to see her until 6 weeks. Like what would you typically recommend? Because I honestly can't remember.
Yeah, I mean, 6 weeks is pretty like standard, but you can absolutely get started beforehand.
Hmm.
Um, I will see some people, I would say the earliest has been like 3 weeks
Yeah.
postpartum. Um, Often, unless we have like specific clearance from their doctor or there's a reason for it, we can start therapy a little earlier, like at 3 or 4 weeks, but
Hmm.
we may not reassess from a pelvic floor perspective, like a pelvic exam,
Hmm.
until they've been cleared by their OB or midwife. So
Yeah.
we can get started. We just might hold off on that portion of the exam until their body is like healed and ready for that. And if they, if they want that, because it's not a piece of therapy that you have to do. I think that that's also just maybe something to point out is people are sometimes scared to come to pelvic
Mm-hmm.
floor therapy because it seems like it could be a little bit invasive. And I mean, obviously it is. We're talking about really personal things in pelvic floor therapy. We're talking about parts of our body and peeing and pooping and sex and like stuff that's usually like kind of taboo. But yeah, so sometimes that initial exam or the thought of a pelvic exam will scare
Mm-hmm.
people away. But I just want to say that it's absolutely optional and not a required piece. And you can still totally make a lot of progress and get a lot of good out of it, even without that.
Hmm.
So I hope that that's not like a deterrent for people.
Yeah, that I'm glad that you mentioned that because that's good to know.
Mhm.
Because I do think maybe I did see her before I was cleared, and we really just worked on like my understanding of how to properly re-engage everything, which that's like a learning curve in and of
It
itself to
is.
like even have that connection and feeling with like your pelvic floor and all of that. But it was a
Yeah,
really good practice, and it's still something
sure.
that I use when I'm working out
Yeah.
today and all those things. Like I still even if I'm in a laying down position, I'll still even try to come up on my side instead of like
Mhm.
straight up, you know what I mean? 'Cause
Yeah.
I just don't want to mess any of that up. So I think it's just a really nice educational piece to have.
Yeah. Yeah, I think so too. It's just a good understanding of how that whole system works. I always tell people the pelvic floor is hard because you can't see it, unlike any other exercises you could watch in the mirror to get feedback on your form and like it makes sense. But when we can't see these muscles and we can't, you can feel them, but it's not the most exciting kind of like you would feel with a really strong bicep curl. That's very obvious. With our pelvic floor, it's just not quite as obvious. So it's really hard to tune in. So sometimes having that like reassurance, having that feedback can build in a lot of ways and is super helpful.
Yeah. Is there anything else that you wanted to touch on for postpartum?
I think that there are times and everyone's journey is like a little bit different, but I just think it's sometimes good to like slow down and honor the body where it is as it's healing, especially if there was any type of like birth trauma or maybe more significant injury during the delivery. Sometimes we need to take a little bit of time to slow down, maybe even to just treat the nervous system a bit, like allow the body to calm down and heal
Hmm.
to then set us up for where we want to go in the future. Because if we have these big goals of, like you said, 6 weeks, we're jumping right back to exercise, but our nervous system is still all like ramped up and our body's holding on to all these tension patterns. Like we just need to give it that time. And, that can be really hard and frustrating for some people. So it's just that grace and knowing that like everyone's journey is a little bit different. And it can take, like you said, for you, it felt like almost a year before you were back to your routine. So it doesn't mean you're not exercising for a year or you're not moving. It just might look a little different as we build back.
Hmm. Yeah, I couldn't agree more. Just having that grace and space for yourself because I feel like there's this pressure that, oh, 6 weeks, just because that's
Mhm.
kind of the blanket statement, like, oh, that's when I should be getting back into my workout routine and bounce back and all of these things. So really definitely just allowing that time and space. And it takes time to heal. And like you had
Yeah.
mentioned, depending on what your pregnancy journey looked like, what your birth journey looked like. I mean,
Mm,
our bodies are depleted of a lot of nutrients, like getting those
yeah.
nutrient stores up, and even like, thinking about like collagen and all that
Mm,
stuff, just making sure that
yeah.
your body is getting everything it needs. And
Yeah.
I just had this thought. I remember my therapist telling me, like, if you massage like your jaw a little bit, like, I'm trying to figure out how I can explain it. It's like the back of your jaw right under your ear that can help relax your pelvic floor.
Your
And
pelvic floor. Yeah. Yeah.
I remember when I would be driving to my appointments, I would be like massaging that area because tightness was something that I struggled with. So,
Yeah.
and I had learned, I took like a little workshop this year, like your jaw it's connected to like your pelvic floor space. So if you experience like jaw clenching or anything like
Mm,
that, like,
yeah.
I don't know, I can't really speak to it, but maybe you would also be experiencing some tightness in
Sure.
the pelvic floor
Yeah.
too.
For sure. Yeah. It's interesting. Sometimes these connections feel so far away from each other in the body, but there's different like fascial connections and through the nervous system, different connections. So it's very true with a lot of my clients who have maybe pelvic floor tension, or they're coming in with different like pelvic pain conditions. On my intake form, I have like TMJ, and they're all
Mhm.
like a lot of them are checking, yes, I have like TMJ issues. So yeah, a nice like jaw massage, just like letting like an inhale and you and like let go with like the mouth open, also just can be really great practice to help release tension through the pelvic floor.
Mhm.
But I think that also brings like up another point that I did want to mention, is that like we're talking about pelvic floor therapy and the pelvic floor, but I think that really a good treatment of a pelvic floor issue, or just a pregnant or postpartum body, is looking head to toe, like not just at the pelvic floor, because there's so many influences, like all the way up from the jaw, or how well our rib cage can move, even down to like our feet and our glute muscles, like all of that influences pelvic floor function. And so I think that as a clinician myself, I have like learned to look outside of the pelvic floor a lot more
Mhm.
than when I first started. It's really this like bigger picture of how is the whole body, the whole movement system like working together.
Mhm.
So yeah, I would just give that as one like point if anyone's looking for pelvic floor therapy, or starting it. You want to feel like, yes, our pelvic floor is our main concern and that's what we're looking at, but like, are we looking at bigger picture? Because sometimes I think we can like miss some really important things if we don't do that.
Mhm.
Yeah.
Absolutely. So taking like a really integrative whole
Yeah.
body approach to it, which is really important and sadly
Yeah.
missed in like Western conventional medicine typically.
Yeah. Yeah. And like teaming up with people who can help from a functional medicine side or mental health side, or just like all these different pieces. Like sometimes we have to get the team put together to really help, especially in that like prenatal postpartum phase when hormones and so many things are like up and down. Sometimes it takes a little bit of a team approach to really optimize everything.
Mhm. So did you have any like pelvic floor misconceptions that you wanted to talk about?
Um, well, so the one was just kind of thinking of like thinking outside of the pelvic floor, like every issue that we might be experiencing, like um, might not just be from a weak pelvic floor. So it could be stemming from a lot of different areas. So sometimes I do have a little bit of a, I don't know the word, but I don't like when the only advice somebody's given is like, oh, go do your Kegels.
Mm-hmm.
Because not everybody needs to be doing them. There are some conditions, and again, it's different person to person, but like there's some people who feel worse when they're doing Kegel. So if they have some type of like pelvic pain or tailbone pain or like urinary urgency, they might find that, they were told to do Kegels, so they're doing them and everything's feeling a little bit worse. So Kegels are not the only answer for every single pelvic floor issue in the world, which is sometimes just what's dished out to people. So I think that's the one, is it's Kegels are not always the answer. You may not even need to be doing them right away. A lot of times our issues are sometimes stemming from a tightness or just an inability to connect with the pelvic floor more than just like a straight our muscles are weak. So I think Kegels would be one. And then, yeah, you don't have to wait. Like, you don't have to have problems to come in. We can jump ahead of things, teach you a lot, and get ahead of some of the common issues so that we're not just taking a reactive approach to everything. And you don't have to have had babies to come into pelvic floor therapy. Like I said, I started when I had to go to treatment. I was like 25. I didn't have kids. I still don't have children. So it's not only prenatal postpartum. That's just, a big chunk of who I see and who will potentially experience pelvic floor issues, but it could really be across the board.
Mm-hmm. I'm so happy that you brought up the Kegels, because that like never even crossed my mind to talk about that. But that's such a good point to make. And maybe you can speak more to this, but I feel like Kegels isn't something that would have been recommended for someone in my case, because I was already experiencing tightness. So I think that could just exacerbate what was going on.
Yeah. Yeah. I mean, again, I'm not like totally against it. Some of my clients do work on them, but it's like, are we only doing that, or is it part of like a bigger picture? And exactly, like if you already have tension, we don't need to be squeezing that muscle. And I mean, I will hear like sometimes like do 300 a day before you're like during pregnancy. And I'm like, that is so much. You wouldn't just sit there and like squeeze your bicep like a billion times a day and that be the only exercise you do. Like, you would probably get neck pain and shoulder pain and all these other things would get kind of weird if that's the only thing you did. So yeah, it's just not a good enough answer to tell people, because that's sometimes the only answer they're given. And then most people are doing them wrong anyways. There's like a study where they gave women like a little printout that said, go home and do your Kegels, and it told them how to do it. They came back and retested them, and 50% weren't even finding their pelvic floor. So again, it's just like, A, not everybody needs it, and B, most people aren't doing them that great anyways. So just not my favorite.
Yeah. So where is your practice located? I believe you are mostly seeing just in person right now.
So my office is in Cleveland, Ohio, a little on the west side of Cleveland. And then I can work virtually with anybody in the state of Ohio. But right now that's really what I'm keeping it to for now. I eventually would maybe like to do some different like coaching or programs, but for now it's mostly just like in-person appointments in the Cleveland area. But I always tell people too that sometimes it's hard to find pelvic floor PTs or know where to go. So I always encourage people, like, even if you just need to find somebody in your area, like, I'm happy to help direct and give some information to get people where they need to go.
That's very generous of you to do that. So what would a virtual appointment look like? I would be kind of curious.
So it's a little tougher. You're not able to get all of the information, but if that's the only option, it's definitely a good option. A lot of it's going to be going through a pretty thorough history taking, asking a lot of questions about if this is like a postpartum individual, a lot about what their pregnancy was like, their birth. We're screening things like bowel and bladder habits, so we can just get a good picture of like what's going on. And then I will do as much of a movement screening as I'm able to through the computer. So we can check like the belly pretty well. We can look at like hip mobility, spine mobility. I can watch their breathing and posture. When it comes to the pelvic floor, like, I'm not able to assess that virtually. So we're going a lot off of like, I'm trying to cue them. They're telling me what they're feeling. So again, the assessment's a little more limited, but a lot of what I do in terms of treatment is very much like education based. So all of that you can still do. You can still educate people. We can still go through the exercises. We just don't have the hands-on component, which again, I do enjoy. And that's why a lot of my practice is in person. But you can get a lot done virtually too. And like I said, especially if you don't have access to care somewhere else, or it's just too hard to get out of the home, it's a good option for sure.
Yeah, that's great that is an option for someone. And since not everyone would even want a pelvic exam anyways, just like the educational piece is definitely very valuable. So for anyone who's listening, if you're in Ohio, definitely check Nina out for sure.
Yeah, definitely.
Yeah, so why don't you share a little bit about where the audience could learn more and connect with you?
So I do try to stay somewhat inconsistently, but regular on Instagram. And my practice is called Horizon Physical Therapy. So the Instagram is Horizon PT _CLE for Cleveland. So that's Instagram. And then my website is just horizonpelvicpt.com. And there's a few blog posts and things on there, or even you can find the Instagram that way, but those would probably be the best two for some information and resources.
Perfect. And I'll definitely be putting those links in the show notes. And do you have any final words that you want to leave with the listeners?
Just that, like, again, nothing when it comes to the pelvic floor, pelvic space, it can be a little intimidating, or we're, maybe taught different things that make us feel some shame about our body. But realistically, like, it's a safe space and nothing is too much information, and just learning about your body can be very empowering. So the courage to take that initial step is a big thing, but I would highly encourage a lot of people to look into it, because it's a really great thing to do for yourself.
Mm-hmm. I agree. And I can tell that just like the love and care that you would give your patients. I loved the therapist that I saw. Like, we would just be chatting. So it ended up being a really beautiful relationship. So just having that level of support can be really helpful. So, well, thank you so much for being here and sharing your story and your passion with us, Nina. It's been a pleasure.
Thank you so much. I really appreciate it.
Thank you so much for tuning in to the Rising into Mindful Motherhood podcast. If this episode resonated with you or gave you an aha moment, stop what you're doing right now and write a review. This simple act of kindness helps me get this podcast out to connect with as many women as I possibly can. I also have a special offer. If you send me a screenshot of your review, I will take $250 off one of my premium coaching containers. Let me know what resonated with you the most and why. So connect with me in my free Facebook community or tag me on Instagram. You'll find both listed below. Thanks again from the bottom of my heart for tuning in to this episode, and I'll see you next time.